My name is Erica, and I'm one of the arthroplasty nurse navigators at the UCSF Orthopaedic Institute. This video was designed to help prepare you for your upcoming hip replacement surgery at UCSF. Once you reviewed the content, please contact our clinic if you have any additional questions. We will review the anatomy of the hip joint, introduce you to total hip implants, discuss preparing for your surgery, as well as the role of therapy, your post-op recovery, and what to expect after surgery. Let's start with the natural hip anatomy. There are two bony areas of the hip joint that we'll focus on. The acetabulum or hip socket in our pelvis articulates with the head of the femur or thigh bone that make up the ball and socket hip joint. These areas of the joint are both lined with cartilage and allows us to walk with a smooth gait. Now, in an arthritic hip, we're dealing with arthritis, which is a loss of cartilage or the cushioning in our joints. Loss of this cushioning causes narrowing of the joint space, which often results in less hip joint motion, decreased function, or pain. When the cartilage has worn out or is destroyed, this often leads to friction and changes in the articulating bones of the hip. Breakdown of this joint cartilage increases friction and stress between these now rough surfaces, which prompts the body to lay down more bony material called bone spurs or osteophytes as protection. These bone spurs are the result of the problem, which is loss of cartilage or arthritis. Ultimately, when the hip joint is worn out, the treatment is hip replacement. In a total hip replacement procedure or total hip arthroplasty, we are replacing your native worn-out hip joint with medical implants. There are four components in a total hip replacement design. First is the acetabulum or cup, which is made out of titanium. Second is the femoral head that sits on top of the third component, or femoral stem, which is also made out of titanium. The fourth piece is a durable plastic liner that locks into the cup, which is made from a highly cross-linked polyethylene plastic. Hip implants come in a variety of shapes and styles, and your surgeon will determine the best size and style for your hip and anatomy. Our surgeons at UCSF only uses current, well-tested implants with excellent track records. The implants we typically use have press-fit technology, meaning the acetabular and femoral stem components have a rough porous coating on the exterior surface. This allows your healing bone to grow into and around this porous coating and lock the implant in place, making it stable and secure. This also means that bone cement is not required for the majority of our cases. In this slide, we can see the arthritic hip before and after total hip replacement surgery. About a week prior to surgery, you will be scheduled for a prepare anesthesia phone consult. During this call, your provider will review your medical and surgical history, as well as all medications and supplements you are currently taking. The purpose of this pre-op consult is to determine if it is safe for you to have anesthesia. We recommend that you complete the pre-op blood work your surgeon has ordered about 2 to 4 weeks before surgery, so that your team has a chance to review these results on time for this anesthesia phone consult. The prepare team will also review when to stop eating and drinking prior to surgery. In general, all patients will be asked to start fasting at midnight the night before their surgery. You will receive a copy of written instructions on when to stop eating and drinking, as well as what medications and supplements might need to be held before the surgery via your UCSF MyChart portal after your phone consult. In general, all patients are asked to hold certain medications and supplements with blood-thinning properties for about a week prior to surgery. These would include over-the-counter strength and prescription strength anti-inflammatory medications, as well as some supplements like vitamin E or fish oil. If you are taking any blood thinners as prescribed by your healthcare team, please be sure to discuss how long they recommend holding this particular medication before surgery. Our goal is to minimize how long you are off the blood thinner medication before surgery and also protect you from increased bleeding at the time of surgery. Before your surgery, you'll be asked to shower with a special antimicrobial soap. This will help decrease your risk for infections around the time of your surgery. HIPAA or CHG, is available at our clinics, many online vendors, and many retail stores and pharmacies. You will be asked to bathe with a special soap, using this from the neck down to your feet, for 3 consecutive days, starting 2 days before the surgery. The third and final wash would be morning of surgery. You will not be able to apply lotion, deodorants, powders, oils, etc. on your body once you start bathing with this soap. Focus use of the CHG over large surface areas such as your legs, arms, and torso, spending more time around your hip, pelvis, and thigh areas. When packing for your hospital stay, please be sure to bring one photo ID, such as driver's license or passport, along with your insurance card. Do not bring any home medications with you, as these will be provided by the hospital team as necessary. Try to remove your contact lenses and wear glasses instead. And if you wear dentures, please bring a case labeled with your name. In general, you will want to avoid form-fitting and tight clothing after surgery, so it would be a good idea to arrive in comfortable and loose clothing, something that is easy to get in and out of. If you are staying overnight at the hospital, you may bring a change of clothing. On the day before your surgery, the hospital will call you in the afternoon to confirm your final arrival time and surgery time. You will be asked to arrive about 3 hours prior to your surgery time. On the morning of your surgery, you will discuss your anesthetic plan with your anesthesiologist. Then you'll be taken into the operating room for surgery, which on average takes about 2 hours for one hip, or about 3.5 hours for both hips. After your surgery, you'll be brought into a separate recovery area where you will wake up from the anesthesia, which might take about 2 hours, but of course, this will vary from patient to patient. Most surgeries will be done at the UCSF Mount Zion Hospital on Divisadero Street, but some patients may be offered surgery at the Orthopaedic Institute Surgery Center. Some patients will plan to go home the same day of surgery, while others will spend a night at the hospital. Your surgeon will have discussed these options and recommendations with you during your surgical consultation. Now, let's review the commonly prescribed medications after surgery. Your orthopedic team will recommend the medications that are most appropriate for you based on your medical history. These medications will be prescribed by the hospital team and sent electronically to your preferred pharmacy after surgery. In our program at UCSF, we use a multimodal approach to manage postoperative pain. This means you'll be given several different kinds of medications to address the different kinds of pain you might have after surgery, which we have found to be effective at managing pain when prescribed together. Tylenol is a mild pain reliever that is meant to be taken routinely about 3 times a day for several weeks. On top of this, you'll be given a medication to address nerve-related pain, which is often described as a burning or tingling type of discomfort. Most patients will also be prescribed a strong anti-inflammatory medication like Celebrex or meloxicam, but only if you do not have contraindications to take NSAIDs or non-steroidal anti-inflammatories. The fourth type of pain medication that is commonly prescribed is a narcotic or opioid medication to address the higher levels of post-op pain you might have. When taking your strong narcotic or opiate medication, it is a good idea to begin weaning down as soon as you are able to by extending the time between each dose. After about 2 to 4 weeks, you may be able to take the strong medication on an as-needed basis, or primarily in the evenings or at bedtime. It is important to note that the goal with the narcotic medication is to decrease the severe pain, levels 8, 9, 10 out of 10 pain, to something more manageable around a 4 or 5 or under. While it is possible to get your pain level to a 0, we don't expect it to stay at a 0 or you to be completely pain-free. While your medications are good at temporarily masking the pain, they do not treat your pain. You will want to diligently ice, elevate, and rest sufficiently between activities to treat the cause of the pain, which is due to postoperative inflammation and swelling. While taking the strong narcotic medications, you will want to increase your fiber and fluid intake and continue the daily laxatives and stool softeners. It is common for many patients to become constipated for several days after surgery. The sooner you are able to discontinue the strong pain medication, the sooner your bowel schedule will return to normal. It is important to keep in mind that your recovery is a process and it will take time for your body to heal and adjust. Bruising and swelling may become more noticeable towards the end of the first week after surgery, and this will certainly contribute to your overall pain level. The first 2 weeks after surgery are typically the most challenging due to the acute recovery phase, with increased levels of swelling, bruising, inflammation, and pain. Please do not overdo your activities in the first couple of days through the first 2 weeks after surgery. It is natural to feel that you want to progress with your activities when you're not feeling as sore or swollen, but we encourage you to take it easy early on. There is no benefit in pushing through pain and trying to be more active than your body allows. You will be able to work on very gentle, basic physical therapy exercises that are assigned to you after surgery, but please do not overdo these. We do not expect you to be able to complete all your assigned exercises every day. To start with, pick and choose maybe 1 to 3 of the very easy, gentle activities, then gradually introduce a few more as your body allows. Let pain and swelling be your guides. Close to week 6 post-op is when most patients can resume low-impact activities while feeling much improved in their overall progress. However, you may still want to work on improving your strength and stamina at this time. Full healing will take several months to a year after your surgery. After surgery, you will work with a therapy team who will provide you with a walker or crutches to take home, review how you should be walking and moving after surgery, review stair training if you have any, discuss any precautions if applicable, and review your gentle home exercises. Keep in mind that these are very gentle, basic activities early on. And again, don't expect to be able to complete all these exercises every day. In the beginning, focus on short, frequent walks inside the home. For example, walking from room to room, small laps in the bedroom or living area of the home. Once your pain is more manageable, which is usually sometime after week 1 or 2, you may then begin to increase your gentle home exercises and go for very short walks outside the home if you're feeling ready. You may have read through our materials and heard from our team members that outpatient physical therapy after hip replacement is optional. While many patients do benefit and choose to go to a few sessions of clinic-based physical therapy, it is not required. The best kind of therapy you can do for your hip is walking. Depending on your specific goals for recovery, you can certainly participate in outpatient physical therapy. If you are interested in physical therapy after surgery, we recommend that you look into scheduling this in advance, as many PT clinics tend to book up quickly. While the timing will vary, most will start outpatient physical therapy about 3 to 4 weeks after surgery. Many patients are surprised to learn that they can walk and put full weight on their new joint as tolerated immediately after the surgery. It is important for you to stay mobile during the daytime during your recovery. You will not be bedbound, nor do we recommend that you stay in bed or on the couch in one position all day. Try to move once an hour or at least every other hour during the daytime. While planning for your recovery at home, please take note of these key points. Please be sure to arrange a ride home from the hospital, as this is required by the hospital team. If you live in a multi-level home, you will want to consider setting up on one level of the home if possible. While stairs are not a barrier to go home or for your recovery, you'll likely want to avoid them in the first couple of days, as pain and fatigue will be your personal limiting factors. It would also be a good idea to plan to recover in a room or area of the home that is close to the bathroom, so that if you do need to get up in the middle of the night, for example, you're not having to walk down a long hallway to get to the toilet. After hip replacement surgery, many patients do like to use an equipment that elevates the toilet seat. While this is not required for your recovery, you might find it comfortable to use a higher toilet, especially if your current toilet is quite low. If you have a walk-in shower in the home, opt to use this over the bathtub. You will find that your operative leg or legs will feel very heavy, sore, and weak right after surgery. And lifting your leg over something tall like a bathtub ledge will be quite challenging. Make sure you are set up for safety in the bathroom, so you may want to consider having non-slip mats inside and or outside the tub or the shower. In general, after hip surgery, you'll want to avoid furniture and seats that are very low or very soft. Your bed should not be on the floor or below your knee level, as this will be quite challenging to get in and out of. You'll want to avoid soft seats such as bean bags or very soft cushions that do not have enough support for you to get in and out of safely. You'll find that after surgery, you're going to use more upper body strength and core strength to get in and out of seats. Since you'll be using a walking aid for a few weeks after surgery, you're going to take up more room inside the home. Consider removing or taping down rug corners, remove extension cords, and other items that you might trip over. Keep your daily use items within reach so you're not climbing up or squatting down too low after surgery. Stock your kitchen with prepared or microwavable foods. While you will be able to heat up meals in the kitchen, you won't want to stand for long periods of time doing any kind of cooking, laundry, cleaning, or other light chores around the home in the first 2 weeks. You will need social support and assistance with these activities, and especially with anything that requires you to leave the home, such as grocery shopping or picking up medication refills. The therapy team will provide you with a walking aid to take home after surgery. Most primary hip replacement patients will be allowed to put full weight down on their new joint right after surgery, but using a walker or crutches will be helpful for your comfort and safety early on. You can also consider purchasing other items for your comfort during recovery. Equipment such as an elevated toilet seat can be helpful if your current toilet is very low. A tub transfer bench might be helpful for those who have a bathtub versus a walk-in shower. We recommend that you visit your local medical supply store before purchasing anything online, as this type of equipment comes in a variety of shapes and styles, and you'll want to select the items that best fit your needs and bathroom. Some patients like to purchase a hip kit or joint replacement kit, which often includes a sock aid, reacher grabber, leg lifter, bathing sponge, dressing stick, and a shoehorn. Out of these items, the one piece I would personally recommend is the leg lifter. However, you can also repurpose everyday items you might have already in the home, such as a yoga mat strap, a long towel, or a belt. Many of our surgeons will use dissolvable sutures, but there may be some instances where nylon sutures are used, in which case they will need to be protected from water, then removed a few weeks after surgery. Most patients will go home with a clear waterproof dressing and gauze over their incision. This will stay in place for 1 week after surgery. After about 7 days, you may remove the dressing. You will have the option of keeping the incision open to air or lightly covering it with new gauze or bandages. With the dissolvable sutures, it is okay to shower normally, allowing soap and water to gently run over the incision site. Do not touch the incision, and try to keep the incision clean and dry after showering. You will need to avoid submerging the incision under water for about 4 weeks after surgery. Please check with your team on the recommended timing for resuming tub baths, swimming pools, and hot tubs. Most surgeons will place steri strips or butterfly bandages across the incision. The steri strips will stay in place for approximately 2 to 3 weeks before they fall off on their own. As your incision is healing early on, you may notice that your incision is a bit lumpy, warmer than other body parts, mildly pink or flushed, or you may have a little bit of bleeding under the dressing, which are all normal. However, if you start to notice increased drainage or bleeding, worsening redness or warmth, or openings along the incision, please reach out to your team. Unfortunately, after your surgery, you are definitely going to be quite swollen, bruised, and sore. This typically has a delayed onset and increases a few days after surgery and is a normal part of the healing process. Both the bruising and swelling typically starts in the upper leg, then will track downward with gravity. You may notice bruising up and down the operative leg, as well as swelling down to the foot and toes. Ice and elevation are key to decreasing postoperative swelling and inflammation. The sooner you can control the swelling and inflammation, the sooner you will have less pain. Try to ice and elevate as frequently as possible throughout the day, especially after any activities or exercises. While elevating, the goal is to raise your foot above your heart level. You can use any cushions or pillows around the home to elevate your entire leg. You may also need to recline your torso back so you can comfortably get your leg elevated. You may ice any part of your leg that is swollen, sore, or bruised. You can use any cold therapy products such as gel packs, frozen peas, DIY gel packs made from rubbing alcohol and water. Since you will rotate through your cold packs quickly, we do recommend having at least 2 to 3 on hand. You will also find that you want to ice your entire leg on some days. Do not use cold packs from the freezer directly on your skin without a thin barrier like a cloth or towel to prevent skin irritation. Remember to work on frequent ankle pumps and circles, as this will also help with circulation and swelling in the lower leg. Another reason we emphasize early and frequent mobility is to help decrease the risk of blood clots. Though developing a blood clot is a risk after joint replacement, the rate of occurrence is quite low, fortunately. You will be given a blood thinner medication for about 4 weeks after surgery. Or if you are already on a blood thinner before surgery, you will resume taking this soon after surgery. Most will be prescribed baby aspirin 81 milligrams twice daily for 28 days. Research has shown that aspirin is effective for blood clot prevention in joint replacement patients. We also recommend that you avoid unnecessary flying for 6 weeks after surgery. Please be sure to discuss any post-op air travel plans with your surgeon. After hip surgery, you are going to have some fluctuating discomfort, pain, and swelling in the lower leg. This is a normal part of the recovery. There is usually an increase in pain and swelling after your activities. Then with rest, ice, and elevation, you should notice a slight improvement in your discomfort level. However, you do want to monitor for any symptoms of a blood clot, which are worsening pain, swelling, and redness in the affected area that does not improve after diligently icing, elevating your leg, and resting. Typically, these symptoms would only continue to worsen regardless of pain medication, icing, and elevation. If there is any worry for a blood clot, please reach out to your team. Let's go over frequently asked questions. Do I need to adjust my lifestyle? Yes and no. We're finding that 90% of implants last up to 30 years. While most patients can resume a majority of their activities, we do recommend that you limit or avoid repetitive, higher impact activities such as running or jumping, as this can cause more wear and tear of the implants. Try to find non-impact or low-impact activities such as swimming, cycling, or rowing. Can my new joint dislocate? Yes, you do have a mechanical device that can dislocate. However, if a dislocation is going to occur, it typically happens early in the recovery before you've had a chance to heal sufficiently. Be sure to follow your surgeon's precautions if applicable, and avoid putting yourself in situations that are risky. For example, climbing a ladder 3 weeks after surgery that places you at risk for fall or injury, or resuming deep weighted squats at the gym before your body is ready for that level of activity. Will my leg length change? Some patients feel that their operative leg might be a little shorter or longer than their non-operative side. This is typically a perceived change. Be patient and allow your body to heal and adjust. This sensation typically improves with time. Your surgeon will make every effort to keep your leg lengths equal. When can I resume driving? You may be able to resume driving once you are completely finished taking your narcotic pain medication and when you feel you have enough strength and mobility in the operative leg to lift and react with it. This can vary from patient to patient, but on average, it might take about 2 weeks up to 6 weeks. When will I be able to return to work? This will vary on what type of physical duties you are returning to. Please reach out to your team for specific guidance and assistance with documentation that you might need to provide your employer with. Will I set off metal detectors? Yes, you do have sufficient metal in your body after surgery that will set off metal detectors, so allow yourself extra time when traveling or going through security lines. TSA and most security checkpoints do not require documentation showing you've had a joint replacement. If possible, choose the body scanner. Dental work and surgery. Prior to surgery, please discuss with your team if you are scheduled for any dental appointments, whether for routine cleanings or invasive procedures. This timing of your dental appointment can impact the timing of your surgery. After surgery, we do recommend waiting about 12 weeks before scheduling your next routine dental appointment. Based on current guidelines, antibiotics are no longer recommended before routine dental cleanings. If you need any urgent dental procedures shortly after your joint replacement surgery, please discuss this with your team. Communicating with our office. Please reach out to our clinic with any further questions. You may also contact your team via the UCSF MyChart portal. During normal business hours, the 415-353-2808 number is the main clinic number for the Orthopaedic Institute. After hours and weekends, this number turns into an on-call number if you need to reach a provider urgently after surgery. We hope you found this video helpful and that you feel more prepared for your upcoming surgery. Please know that you have an entire team in the clinic to help guide you along the process and answer any questions we may not have reviewed in this video. Thank you.